Well, it's going to start with us doing an exam on you, okay? We're going to assess your body by doing range of motion, see how much range of motion we have, because that will be a big bearance on that, okay? So, for example, if we're going to look at our spine right here, we look at it from an anatomical position right here. This is a perfect spine, so to speak. Equidistance, everything's down midline right here, okay? Let's just say if you were using your right side a lot, what it's used for the lower back in construction or something, or rotating a lot, we're going to pull that spine over and over and over, okay, to the point where it's going to fatigue, come downwards, compress, and irritate that nerve, okay? That nerve if we're looking at a graph, nerve graph, it'd be nice and easy, a healthy nerve, okay? Once we start compressing on it, it's going to be more erratic, okay? It's going to spike. We're going to get contraction of the muscles, okay? And eventually pain. And to that level of pain is how we assess that. We do that by doing an orthopedic exam as well, okay? So we're not reinventing the wheel, and every time you go to your orthopedic doctor and every time you go to any other doctor, they should be doing these exams. They're charging their insurance for it. Check your insurance on it. That's what it says. We took it for a cranial nerve exam. Very simple to do. And then the orthopedic exam points us in the direction of where that joint's coming from, okay? We're not guessing at stuff right here. Once we did a certain orthopedic exam, it's going to lead us right to that neighborhood, okay? And then once we go further through that testing, it's going to lead me to the house. And then we treat that condition properly, okay? We use a lot of physiotherapy in our office, okay? The spinal manipulation is why you're here, okay? But soft tissue health is extremely, extremely important, okay? As we get older as well, okay? So we use electric stimulation with mechanical traction, okay? So we're stretching the spine, we're also controlling the swelling. So when you walk in here exuberant amount of pain, we can actually work on you. We're not gonna have to wait 2 or 3 days. We're gonna do some ultrasound therapies which stimulate something called fibroblasts. Our fibroblasts equal collagen, okay? So we see collagen on the TV all the time now. We're trying to drink it and put on externally and everything like that. We want to stimulate internally. We're going to use mechanical traction that does passive stretching. Okay, so passive means you're not having to use the muscles. Okay, you just pulled your back out trying to come into the office and spasm for trying to use the muscles yourself. Passive eliminates that. So I can get movement back into the spine, increase blood flow, and start the healing going on there. And get the movement back there. That's what you're there for, okay? If the movement was there outside of an injury, we're probably not having you in our office today, okay? It's gliding, it's moving, it's not pushing down on something. Repetitive movements are what we're always doing today, okay? I would say when I first started off in practice, and all the other practices I started off was all lower back pain. Nowadays, the exact opposite. It's all upper back time. And then what we're seeing even before all that is our kids are on these iPads earlier. I didn't really have a computer in my hand full time until I was 30 years old. So we're seeing a new generation. Exciting to see this, great cases, but also scary at the same time. You know, because we see a lot of people now trying to relieve their necks by rowing and popping it on their own, which we need to talk about that before we leave today for sure. And the physiotherapy helps with that. So when you come in the office right here and it's really, really tight, trying to adjust the spine sometimes, you need to soften it up, so to speak, increase vascularity. And there's other alternatives to that as well, mechanical traction. So dry needling is something I use a lot, and red laser therapy, I should say. We use those also to increase blood flow, okay, and increase something called fibroblasts. Okay, you don't really need to know that, but just know that fibroblasts can equal collagen down the road. Okay, so if you're doing a cup of collagen that day, maybe you can take less that day and do that. And then of course, we're going to touch on nutrition and stuff here too, because it's very, very important. You know, we're just one cog of the wheel. We fix one thing that's part of all the things. And there's a lot of other players with us too, nutritionists, PTs, and we're the chiropractor though. We're going to handle every angle when you come into our office. We're going to sit down, we're going to go to the where, why, and when. the soap notes. You know, we're not going to plug something to the computer. We're actually going to dictate it out so we can go back and read it again, which is helpful for me. And again, all good soap notes, there's very good softwares there, but dictating the notes out is important to me. And some hospitals still do that, you know. They're more thorough. You're reading the story of that patient, and it's just a minute. It's what they're telling you, what they feel, and you pinpoint on that with a good orthopedic exam, good cranial nerve exam, and then, of course, we have digital x-rays. We can really dime in on the bone structure at that point in time.